Behind all the statistics, the calls to get tested, the fundraisers and awareness events, there are women struggling to survive this deadly and growing disease called breast cancer. Every October, we wear our pink as a symbol of our support for the survivors and for the many, many casualties of this deadly disease. We've heard their stories and wiped their tears, even celebrated their victories. Yet, we continue in a perpetual cycle of diagnosis, treatment, recovery, and remission, and sometimes reemergence and defeat. While we as the public and the media give focus to the issue every October, the people that live it every day are in this battle every day. Tonight, we dedicate our show to breast cancer awareness and winning the battle. My guests include a man who has dedicated his career to the fight through medicine and two ladies who are survivors. Our discussion begins on the other side of this break. Welcome to On the Record. Tonight we focus on an ongoing battle in our community that has already taken so many from us despite decades of fighting. But there are many who are living to tell the stories of survivors. Our Megan Shepherd recently featured one of them.
In the moment, I was very calm, and I'm very grateful about that. I had my family there with me in the room when I found out, and it wasn't a moment of sadness. It was a moment of, okay, what's next? What do we do? How do we fight this? So I'm grateful for the support that I have around me in that moment where I wasn't overwhelmed with sadness, but more of ready for the journey ahead of me.
Bo, who now exudes a sense of peace as she recalls her journey thus far, says it has been a roller coaster ride. She admits that there were some low points, particularly when undergoing chemo treatments. And as a professional chef, she says losing her sense of taste was a major challenge.
In January, I had a bilateral mastectomy done, and that took a lot out of me. And then I've went through the chemo process and like just the multiple doctor's visits and, you know, feeling sick, like the whole symptoms of chemo and just going through the process. But overall, I would say that I can't say that it's been an overall negative experience. I'm extremely grateful for the family that I have around me. There's been joy in this experience for me, and I'm grateful to God in that experience because it has to be something else external within myself because I feel peace, and I felt peace throughout the journey thus far.
And as the world comes together to recognize Breast Cancer Awareness Month, Bo says she believes there still needs to be more sharing of information.
People wear their pinks on Fridays, and I think that's important as well, but I do think there should be more research involved in it. In the Bahamas, we have a very high rate of breast cancer, and it's just overall having the materials needed. If there's seminars, lectures, or just speaking engagements of survivors, doctors, once you get diagnosed, what does it look like? Because that was a journey for me. What's the next step? I don't know. And I think it's the fear of the unknown.
And to those still in the fight,
it's a mindset thing as well. I would say try to stay positive because breast cancer is not a death sentence. And when people hear it, it takes a moment to get there, if I'm being honest, but it's not a death sentence. You can still live, you can still work. Yes, this is something that's going on in your life. It's something that you are fighting, but it's not over. Just stay encouraged on the journey.
But the real battles against breast cancer are fought in physicians' offices, treatment centers, and operating theaters daily. Dr. Don Major is one of the country's top physicians. He's a surgical oncologist at the Princess Margaret Hospital. Welcome to On the Record, sir.
Thank you for having me.
So, to help the audience understand why we've chosen you to have this discussion, first of all, what is a surgical oncologist?
So, a surgical oncologist is a general surgeon. So, we have the training of a general surgeon that does basic surgery, but we have training in cancer surgery as a specialist. So, we basically have a 2-year training program after you've completed your general surgery to go ahead and do in order to become a surgical oncologist. And in surgical oncology, we deal with the common cancers such as breast, colorectal, stomach. We also deal with liver and pancreas cancers. So here in the Bahamas, where breast cancer is so pretty common, it's good to have a surgical oncologist on board to be able to help these patients.
Was there anything in particular that drove you to this specialty?
I think what really drove me to it is the uniqueness of it, as well as the complexity of the procedures that we are able to do. Because as a general surgeon, we do quite a bit of operations. A lot of them are emergency operations, as well as, elective procedures. But in surgical oncology now, you get to take out really large tumors. You get to, go places where the general surgeon wouldn't necessarily go. And when you go there, you have this bit of confidence about, you're able to successfully remove this and successfully help this patient in whatever disease process they may have.
I have to admit, once you said 2 more years, all I thought was there's no way. So I applaud you for that.
Yes,
I always think
yes.
doctors in school forever,
Yeah.
but they have to do 2 more years. But seriously, how do most patients come to you?
Okay, so we're now getting better with respect to screening, right? And screening is where we test an at-risk population for a disease that's popular or common in those patients who are asymptomatic, so they have no signs of the disease. And for screening for breast cancer, that is the mammogram. So we're now seeing more patients come to us with these screening results. So they've not felt any lumps in their breasts, or they just went for routine screening and there's some abnormality that showed up. And we go ahead and we address that and show them how to deal with that. However, we still see the patients that don't get any screening and then that kind of wait until the end when they have this large tumor or something that's bleeding, and then those patients, it's a bit more challenging to actually deal with those.
You touched on this a bit, but how prevalent is early detection in those patients that you encounter? You mentioned that you see more of it. And on the flip side, how many of them are you seeing now are perhaps in the advanced stages of the disease that you also mentioned?
So the advanced stages seem to be dwindling, but this is just my personal experience.
Sure.
I don't have any numbers to say that it is or it isn't, but it feels like we're seeing less and less of it as the population becomes more aware. But you still, have those patients that, had this thing on their chest for about a year, and then now they finally come forward and be like, can you help me with this? And really your hands are tied by that time.
Wow. What are the options available, though, to someone who is diagnosed with breast cancer? Let's start with the early stages first.
Okay, so first thing we have to do is actually stage the patient once they have a diagnosis of breast cancer. And how we do this is with a history and clinical examination, just to make sure that there isn't any evidence of clinical spread of the tumor. And then after that, we go ahead and we get them imaging. And imaging most commonly is in the form of a CT scan or a PET CT. So a PET CT has the convenience of looking at the entire body for any cancerous cells that may show up elsewhere. So for those individuals who don't have any spread anywhere, right? So let's say they're early stage, they're stage 1, so they have a pretty small tumor. There's nothing under the armpit where the tumors tend to spread. These individuals, they tend to get, whether with respect to surgery, they can either have that area of concern removed and they get to keep the breast on, right? As well as test the lymph nodes under their arm. So that's one option. That option is called breast conservative therapy. However, with that option, these women have to get radiation because whatever it is that caused them to develop that breast cancer in the first place, they still have the remainder of the breast that's on, so you have to kind of sterilize that. The other option is the mastectomy. This is where we remove the entire breast, as well as we test the lymph nodes under the arm. And in these individuals, they can get reconstruction. So they can get reconstruction at the same time, or they can get reconstruction in a delayed fashion, depending on if they need additional treatment or not. And some women, they have the BRCA gene, which is something that we test for most commonly in the women who are under 40 with breast cancer. If they have the BRCA gene, we recommend that they get a bilateral, so we remove both the breasts. Or if they have a pretty strong family history, so they got aunts and cousins and mom that had breast cancer, it's probably best that we remove both, and then we still offer them reconstruction if they want it.
What kind of treatment, or how hard is it to treat someone in the advanced stages?
So the advanced stages can be a bit of a challenge, especially if they have spread elsewhere to like the liver, because when it spreads to the liver, sometimes it can obstruct the duct that drains the liver, and these people can become jaundice. So the eyes become yellow, and in this state, it's very difficult to give these individuals chemo, because when they get the chemo, it kind of affects the liver even worse, so they can go into liver failure, and then this becomes obviously a big problem for the patient. There's not a lot of surgical options when it's advanced, right? So it's mainly chemotherapy and radiation that these patients have to get.
How much of a factor is time, from the time of diagnosis to the time of the start of treatment?
So it all depends, right? So if you have an early stage cancer, I tend to tell women it's not an emergency, right? So you have time to now go home, read up about it, talk to your family about it. We've spoken about the options. You can come back for another visit with family members. We can all discuss it as well, and then we could kind of formulate a plan for you. So if you have an early breast cancer, you're probably looking at, a month, 2 months before you have to say, okay, yeah, let's get this started.
What's the survival rate like, particularly for those who are in the early stages?
So survival rate's pretty good for those in the early stages, right? So we're talking stage 1, stage 2. So we're looking at, for stage 1, we're looking at least a 95% 5-year survival, right? And when we talk about stage 2, you're probably looking at around a 85 to 90% 5-year survival. But it kind of drops off as you get to the stage 3s and the stage 4s. And this is why one of the reasons why we push the mammogram so much, because we want to get you before you get to the stage 3 and stage 4.
As early detection, of course, continues to be, the greatest weapon. Well, at this very moment, hundreds of women are facing the reality of a breast cancer diagnosis. When we come back, we talk more about treatment methods and early detection. Then later on, survivor stories. You're watching On the Record. Advancements in treatment methods and therapies and a network of support have helped to change the game for breast cancer patients, but early detection is still the greatest defense. This is On the Record. Tonight we're focusing on the ongoing battle in our community. My guest is Dr. Don Major. He's a surgical oncologist at the Princess Margaret Hospital. So what makes chemotherapy such a difficult treatment method for a lot of patients? I hear people talk about how grueling it is. I know it from personal experience with a family member. But what makes it such a difficult treatment at times?
So, great question, Jerome. With respect to chemotherapy now, when you look at the basis of how it works, basically it destroys rapidly dividing cells, right? And any cell that has a pretty short half-life is going to be affected. So these are cells that line the GI tract, so cells in the colon, cells in the small bowel. These are your hair follicles. These are cells under your nail beds. And this is why people's hair would fall out, or they may get a lot of nausea, vomiting, or they may get a lot of diarrhea afterwards.
Dark fingers.
And the fingers that turn dark, and it also affects the nerve ending. So some people can have basically numbness and tingling in their hands and feet that sometimes once the chemo is done, that wears off, but some people it's permanent. And we're at this point now where we haven't necessarily identified anything that's better than chemo to say go ahead and treat these patients. So it's something that has been proven to be effective, and this is why we use it. but we know it has these side effects that we try and minimize with other medications, but still a lot of people.
I guess I was going to ask, are there any studies being done to further minimize the effects of the chemotherapy? Because I can tell you in some instances that's even a deterrent for people, particularly if it's a reoccurring situation with cancer.
I know, because I've had patients that come back to me and it's like, doc, I can't take it, but the thing about it is it affects everybody differently. Some women, they can take it and it's like nothing ever happened. They go to work the same day and no problems. But some women, they get it and they're out for 2-3 weeks until the next round. And you don't know how it's going to affect you until you actually get it. And with respect to studies that look at minimizing the effects, I'm sure they're out there, but I'm not a part of the chemo giving side of things, right? So I'm not as versed with those studies, to be honest. Because generally we refer them to a medical oncologist, so who deals with chemotherapy. And once we've done the operation, we'll follow them routinely, but then we see them periodically every 3 months afterwards.
Now, there are other methods of treatment out there: radiation, immunotherapy, hormone therapy, checkpoint inhibitors, external beam radiotherapy. Is there a difference in the effectiveness of these pathways in healing and recovery?
So if we take the hormonal therapy per se, because that's a big one that we use, it's used as an adjunct to chemotherapy and surgery. And it is used in individuals who have a specific type of tumor. So generally when we test women for breast cancer and they've been diagnosed, we send that sample off for receptor studies. And the receptors are just proteins that are found on the tumor. And the receptors we look for are estrogen, progesterone, and a hormone or a protein called HER2/neu. So now if you have the estrogen and progesterone receptor, which is usually present in about 70% of cases, you can use the hormonal therapy to treat these women for about 5, sometimes up to 10 years afterwards. And it's generally just a tablet that they take once a day for this period of time. And what that does is that minimizes the risk of this tumor ever recurring and minimizes the risk of it showing up in the other side. Now, if those women do not have those receptors, then basically chemotherapy and surgery and plus or minus radiation are their only options. They cannot take that medication. And they also have the trastuzumab, which is a monoclonal antibody. So you can use that for individuals who have the HER2 positive breast cancer. So they have quite a bit of medications out there that they can use in adjunct to chemotherapy. It hasn't necessarily come as a mainstay in front of chemo and try and avoid chemo.
So it's chemo and then these other treatments. There's also this controversial stem cell treatment. We've heard this being talked about in other jurisdictions for a while. In fact, the Davis administration is promising to repeal and replace the current Stem Cell Act to tighten its regulatory framework. Health ministers on record saying they will replace it with modern law. How critical is this, from where you sit, for exploring stem cell transplants as a local treatment option?
Now, again, it's not necessarily gold standard for breast cancer treatment, so it's more experimental at this point in time, right? So what would likely have to happen is, we'll have to figure out whether or not this truly works. And if it truly works, then fine, we can go ahead and use it as an adjunct for breast cancer patients. But at this point in time, there's really no data that says that, okay, if I give you stem cells, your breast cancer is going to go away, it's going to be the treatment of choice. And until we get there, we still have to kind of stick with the conventional methods.
We're still not to the point where the stem cell replacement is definitive.
Yes.
It's still one of those experimental.
Still work in progress.
Are people, and I often wonder, are people open to the experimental drugs sometimes? Or are they, you find them more conservative in the treatments and let me stick with what's a little more tried and trusted?
I think you may have a subset of people that would be open to the experimental medication, but then I guess it's finding the appropriate physician that would say, go ahead and, okay, I'm going to give you this experimental drug. I'm not sure if it's going to work. I think it may. Right. And then go ahead down that route.
There are many support groups out there who are side by side with these patients. To what degree does that help? I mean, you obviously are responsible for the surgery, then there's the medical part and the treatment with the chemo. but then you have these support groups.
I think the support groups are great. They think that really helps the patients with respect to seeing others that may have gone through the same thing that they have gone through and having that, you know, somebody to talk to. And that's one of the things I recommend for my patients as well, you know. So we have the Sister, we have the Cancer Society, we have other support groups that if you can get involved with these ladies or individuals, they'll be able to help walk you through this process because they've done it already. Right? And they have women that survived it and they have women that have good stories. Because generally, you know, when you see patients, they come to you with all the bad stories. Oh, I had a cousin who did this and they had this problem and, you know, I had an aunt that did this. But they rarely come with, you know, the good success stories, and these are what the support groups help them to realize that there are success stories out there and people have gone through it and lived a pretty good life afterwards.
What's the hardest part of treating your patients?
I think the hardest part of treating my patients is when it comes down to the end, right? So basically, let's say if you have a stage 4 patient, meaning that it's spread to the lung, to the liver, and chemotherapy is not working, and just trying to know that time, okay, when is enough? You know, do we continue on the chemo route even though we know it's not working? And then trying to help them as well as their families transition for that time period when they're no longer going to be here. I find that with respect to my job, that is the most difficult.
I'm sure. Is there anything to suggest that these high incidences that we are seeing are full genetic or come from the result of a shallow gene pool? It's a conversation that I've had with physicians, and I keep asking the question, is there anything to suggest that it's genetic or the fact that we're such a small population?
Well, I think that has a major part to play with it. But again, if you look worldwide, breast cancer is pretty common in women all over the world, right? And that's not necessarily a small gene pool.
Sure.
But I think for us, it's you know, special in the fact that, you know, we're on an island, and then, you know, we find it difficult to access, you know. I think most people want to stay at home with respect to their relationships, etc. And then if you have a genetic problem and you get involved with somebody else that has a genetic problem, then you can see
marry
where,
your cousin.
Yeah, you can see where that can go, and then that can increase your chance for developing other problems.
Sure.
So it has a role to play.
So, Dr. Major, thank you so much for coming on, and you've provided us with such a wealth of information. Also, keep up the great work.
Thank you.
Thank you so very much. You came highly recommended, so I encourage you and I thank you, and I'm sure there are many families in the Bahamas who thank you as well for your work.
Thank you for having me.
All right, so she who lives it knows it. A truer phrase could not describe my next two guests any better. When we come back, meet two breast cancer survivors. This is On the Record. We'll have more in a moment.
We know and we see the need of persons who are hit with cancer, especially those from the family islands. They come into New Providence to get medical treatments, and sometimes they have nowhere to stay. They don't have the money. They can come into Sister, and they can get a port, an expensive port that costs anywhere from $500 and up dollars. They get it free. Sister is doing a great thing to support cancer patients.
Just a glimpse into the realities of breast cancer and the fact that the fight continues, and so many organizations out there who are helping our women who need the help. My first guest says she's not a victim, but rather a survivor. She's been battling cancer for 12 years and is about to release a book called The Survivor's Journey, Faith Pulled Me Through, co-pastor of Whole Armor Ministries. Welcome, Shakira Sears. Welcome.
Thank you for having me, Jerome.
Looking forward to a great conversation. And 23 years ago, my next guest was diagnosed with breast cancer. She immediately opted for surgery and chemotherapy. Today, she tells a survivor's story as well. She's cancer-free and a motivator for other women. Let's welcome Sheila Smith. Welcome to the show.
Thank you for having me, Jerome.
So, Shakira, let's start with you. What really made you get tested in the first place?
Well, it was just a regular annual physical. I went to get my physical checkup, and when I went in, my doctor was the one who discovered that there was a lump in my right breast. And so when she made me aware of that, she said, you know, you have to go ahead and have this tested. Immediately thereafter, several days, I had an appointment, had a biopsy done, had particles of the breast tissue sent off for testing, and in a matter of weeks, I was being diagnosed with a stage 2 breast cancer.
Sheila, tell us of your experience to discovery.
Well, it was rather shocking, to be honest, and unexpected because I had missed an annual mammogram. My doctor insisted on his patients having mammograms in actually mid-30s. And so when he went on sabbatical, and I did not do my mammogram because I was under 40, and he came back, he said, you have to do your mammogram. And I said, but I'm under 40. He said, it doesn't matter. You're under 40, and I want you to go overseas and do it, which was a shocker because I had done the first one at Doctor's Hospital. But he insisted that I do it, and so I went and had the mammogram done in Fort Lauderdale, and lo and behold, they looked at me and said, we see a lump. I said, no. My husband is a breast man, so there can't be a lump. I felt, and I felt nothing. And so they said, well, you have to be examined by a doctor. At the same location, I had the examination, and they found a lump, which was almost the size of a quarter. And so that was a shocker. I was thinking that maybe the mammogram had moved this lump, and suddenly I felt the lump after the doctor examined. And he said, you have to do the ultrasound. I did that. Then he said, you have to do a biopsy. Now, that was the scary, that's when it started to hit me that, hey, the biopsy, that sounds like a needle. And I'm afraid of needles. So that was a shocker. But after that, I came back to the Bahamas and got the news a week later that I had stage 2 breast cancer.
What was the moment like for you when you were told you have stage 2 breast cancer? Take us to that moment.
Oh my God, that was just so, I vividly recall sitting on the back patio, overlooking the water, and I instantly looked at my doctor and said, what do I do next? And he said, you know, relax, relax. I said, seriously though, I want to know, what do I do next? He said, well, you're going to have surgery for sure, and you're probably going to have to do chemotherapy, but one step at a time. I said, okay, what's the first step? He said, surgery. I said, could you please call your favorite surgeon and let him know that I need to come and see him as soon as possible?
You were wasting no time.
I was wasting no time, seriously. And of course, in hindsight, I wish I had wasted some time.
Why?
To be honest. Because unfortunately, I was gung-ho on getting everything done. And after I had my surgery, my brother found out that I had breast cancer. He said, I have a friend who's an oncologist in Canada, and he wants to see your records. And this was after the surgery. And I was told, you should not have done the radical mastectomy. So that was depressing after that, because, I mean, every woman would like to keep both breasts when possible. I lost one, but at least I have one. So I'm grateful for that.
Shakira, let's go to your experience. Like, what was that moment like for you when you found out?
Well, I received a call from my doctor on that Saturday. I was actually on the road running errands, and she called me and she said, Shakira, I need you to go and see Dr. Wesley Francis on Monday. I've already made a appointment for you, and I need you to go in to see. And right then, it hit me that something was wrong. And so when I went into Dr. Francis, my husband and I, we went in, and you know, it was like a battle going on the inside, just seated on the outside of his office, awaiting to go in the room. there were different women coming out and they were crying and, you know, nurses walking them out. And I'm like, what is this? When we walked in the room and we took a seat, Dr. Francis came in with my medical report in hand, and he said, you have stage 2 breast cancer. At that moment, I'm a firm believer of the faith. I had already had a conversation with my Father in heaven, and he had already told me that you're gonna go through this, but it's for my glory. And when he said that, I was like, okay, because, you know, I was, during the time prior, just waiting on the results, it was like anxiety, emotional, you know, my emotions were all over the place. And I'm like, God, why is this happening to me? Why me? Seeing that I'm the first person in my family, it's not in the family history. And so when he told me at that point, I just looked at him, looked at my husband, and I smiled and I said, okay, this is it. I have to go through this. And so at that moment, my husband looked at him and he said, Dr. Francis, he said, we're gonna go ahead and consult the greater physician. We heard the reports. He said, but we just wanna have that conversation and speak among ourselves. And that's exactly what we did. And right after that, everything just started to go so quickly, you know, because everything was like, time to move forward with this.
What was your course of treatment?
My course of treatment, I had 6 rounds of chemotherapy, 12 rounds of radiation. I did the partial lumpectomy, taking off just a part of the breast. When they did the examination, the lymph nodes, none of that was affected. But I still had to do the radiation to do a cleanup, mop-up session to make sure that they would have cut all of the cancer out of the breast. And the chemotherapy was atrocious. It was crazy.
We talked about it in the last segment. You
Yes.
know, in most cases, I've heard that it's the chemotherapy that's really
Yes.
the hardest part of the journey. You agree?
I agree.
Yes, sir.
That's
want
the
me to-
toughest part.
Yeah,
Yeah, sure.
really
Tell
tough.
us
Yeah.
about your experience.
Yeah, the chemotherapy, my first chemotherapy when I went for the first dose, I figured, it isn't so bad. But 5 days after, my body took a turn for the worst. And my husband had to rush me back to the doctor. When he rushed me back, they said your white blood cells dropped, the count had dropped. And so during my entire process, I had to constantly take this shot in my stomach 5 days after I do chemotherapy. The chemotherapy was like, I thought I was about to die. So for me, my first, the 4th, and the 6th were crazy because I can't tell you what goes on in the body, but you know that the chemotherapy, it's normally attacking the good cells and the bad cells. So there's something going on in the body, and it was just crazy. And, you know, prayers is what pulled me through. Prayers.
Sheila, what was your experience like?
Well, I was actually in the U.S. doing my first chemo, and I sat in the chair, comfortably, nice atmosphere and everything. And then they brought the red devil. That's what we call it. I was doing fine until the nurse appeared with the red devil. And I just burst out crying. It was overwhelming to see it just coming towards me. But the nice thing about it is, it seems like women, when they're diagnosed, there's always support teams around. And every woman that was in that place came towards me and hugged me and said everything is going to be okay. Now, my first chemo wasn't really bad because I believe in retail therapy also. So after every chemo session, I had to go shopping. for fancy sandals.
I love it.
Fancy sandals.
I think in retail therapy, I was about to Google. I love that. Okay.
Yeah. So after every chemo session, I have to go shopping for fancy sandals. And so the first wasn't so bad, but the second one really did me in, I must admit. I stayed in bed for a whole week. I didn't eat for about 6 days. I was drinking, thank God. But my oncologist, when I spoke to her, she said, oh, you should have called right away. But of course, I didn't have the energy or the gumption to even call. I was just like, just let me sleep, just let me sleep. I don't need to eat, I don't need to do anything, I just need to lay here. So chemotherapy is a necessary evil.
Right.
That's what I call it.
Were there times that either of you felt like giving up, like, you know what, this is just too much. I'm ready to throw in the towel?
For me, not one time, not once. Because I had that comfort that I was going to come through this, you know, I always base myself on reminding myself of the biblical scriptures and what I heard in my spirit, that I shall live and not die. And so, you know, there was one time my mom came at the house and she was like, you need to stop taking this thing. It's killing you. You're deteriorating every day. And I'm like, Mommy, hold your thoughts. I'm looking at myself in the mirror. I can see what's going on, but I believe that I shall live and not die to declare the works of the Lord. And so with that, every day it was, you know, having the family support there, knowing that I had 2 children to live for, my husband there to be very supportive, and even my employers, you know, just to know that they were supportive throughout it all. It made my fight a bit more easier. Even though it was a struggle, it made it easier that, hey, I had to live. I had to overcome this.
We'll spend some time talking about support later on in the show. But again, Sheila, what, you know, were there times you thought, you know what, I don't know if I want to continue on this fight?
No, there was never a moment. I knew when I was in the surgeon office, remember I had gone gung-ho about this whole thing, in the surgeon office, when I asked him when can he do the surgery, and he said, I will call the hospital and see what we can schedule, I then said, I'll be right back, excuse me. I went into the washroom and I prayed and I cried. I said, Lord, you just got to get me through this. I have 2 young daughters and I need to see them grow up, get married and have their own families. You have to take me through this. So all throughout my treatment, I felt confident that he was going to do it. And so it was never an issue of giving up.
Every time you hear of someone passing away with a diagnosis as yours, a diagnosis of breast cancer, how do you feel? What happens to you in that moment?
I get really depressed about it because I instantly start thinking, did they have the support that they needed? Were their doctors on top of things? Were their family supportive? I start thinking, what could I have done had I known how to help them get through this? Yes, I know that some will survive and some will not. That's a proven fact. But what I am committed to is doing whatever I can to help people to understand that there is life. Yes. And you have to think life. You cannot think death. Death may come, like it comes to all of us. But you must think life and you must do everything possible to survive.
Do you have similar thoughts?
Yes, for me, you know, when I hear about persons dying, I always try to figure out, I wonder, the same thing Ms. Sheila said, did they make up their mind that, hey, you know what, I'm just going to give up? Because when you diagnose, the first thing you think about is, oh, I'm about to die. Do they really... did they really take the necessary precautions that they needed to take in terms of whatever the doctor may have said, in terms of, you know, having the surgery, having the chemotherapy? Because a lot of persons make up their mind that it's over, I'm just gonna die. And so when I hear that, and I hear people passing away, my heart is grieved, and many times I am grateful that I am still here. Because when I hear about persons, okay, stage 2, I'm like, really? And you gone? But I'm grateful. You know, and so...
Ladies, very inspiring. Well, during this month, we hear a lot about breast cancer awareness. Free mammograms, get tested, and that early detection is the best defense. But what about those other 11 months? Well, you're watching On the Record. We attempt to get into those questions and much more right after the break. And we are back. This is On the Record. This week we are focusing on a very important subject, and that is the ongoing battle against breast cancer. My guests of this segment are 2 breast cancer survivors, Shakira Sears and Sheila Smith. Ladies, you really represent the best of this disease and overcoming it. What would you say really helped you, not just from a medical perspective, but also from an emotional perspective, to be able to overcome this?
Like I said a little earlier, it really was the support of my family, having the support of my employers, understanding what I was going through, affording me the time to go to the doctors, to do what I needed to do. And it was just that the prayers, to have your family members surrounding you, praying with you, believing that you're coming out, that alone showed so much love. And so for me, what I normally say is prayer, love, and the support of family.
That positive spirit seems to be
Yes.
very, very important,
Yes.
Yeah, it is. Yeah. I would say prayers, family, and supportive friends really got me through it. And as I continue through it, because it never ends. Every year you go and you have your physical, and you go through that nervy period where you want to know, is everything still okay?
Right.
So our support group here in Nassau, Jenny
Yes.
Dean Caring and Sharing Support Group, is what keeps me on the positive line right now. And so it's very, very important to have good support from your
Yes.
family, your friends, and other survivors.
How do you get women to talk about these things? And I'm asking because I know, my grandmother and, that era, and even my mother from that era where they didn't talk about women's health issues. Whatever they were dealing with, that was a personal thing. They didn't, especially where men were involved. But do you see that changing? Are women more open now to talking about these issues?
It's coming together. Ms. Sheila just mentioned the GD Caring and Sharing Group. That's a cancer support group she and I are a part of. And persons, when they have been diagnosed, normally tends to go into the shell and feel as though, okay, it's all over, and they're afraid or embarrassed to talk about it. But I always tell persons, sickness is no respect of persons.
Sure.
And so once you find out that you've been diagnosed, it's good to come into a cancer support group, because what we do is sit down, we share, we help you through it. It helps through the emotional battle, it helps through the physical battle, and just to know that others are going through what you, or have been through what you are going through, it's a great help. And so we have a lot of persons now coming into the group and understanding that it is family, it's loving one another, it's laughing, and it's living life.
So whether it's wearing pink, whether it's participating in a walk, run, or something to raise money, or just wearing a pink on a Friday, or whatever it is, there's a lot of promotion
Yes.
during this month for breast cancer awareness. We're going to take a look now at one particular initiative.
Cancer sucks. Early detection is the best. And so we find it necessary, or we feel that it is necessary to continue to do this, to ensure and pull people out so that they would go and get checked, so that they become aware that it is there. The best detection is early detection.
So there we have the Member of Parliament for South Beach promoting the second annual Connect for Cancer Fun Run Walk and Mini Health Expo taking place this weekend. It's sponsored by Cancer Treatment Center of America, City of Hope. I chose this particular example as an example of the enormous push that we see during the month of October. Do you think it's enough?
It's not enough. It is not enough. And I'm saying that simply because after the month of October, everything dies down. You don't hear anything about it. There's no awareness. People are dying every day. People are being diagnosed every day. But there's not enough, talks about it. And I feel as though we need to have more forums, going into the schools, persons, so they can understand that early detection does save lives. A lot of persons do not do their annual physical checkup simply because they feel as though it's not necessary.
I find that almost surprising because there is such a huge emphasis during the month. And I guess I minded to ask, do we do it because it's popular? Because everybody's wearing pink and we're going to wear pink? And do we do it because it's popular?
Not really.
Okay.
We do it because it makes money.
No, sorry, not. Oh, well, there you go. So repeat that part.
It's so commercialized. People make money off October and the pink. And I wish that more of that money would be directed towards supporting groups like Jenny Dean Caring and Sharing Support Group. More effort need to be made, more educational material need to be produced. We try to do forums, we try to do a lot of Facebook and everything else, but it's still, the message is still not getting out because I still meet too many women who did not do their mammograms,
Right.
you know, and they don't take it seriously.
Well, you know, is the thinking, oh, well, I did one last year, so maybe I'll skip this year. In your case, you know, I'm under, you know, under particular age. Am I okay for now? Is that the
Yes.
thinking?
Yes.
Yes, that's the thinking, and I think if there's more exposure, more people like Shakira and I out there speaking and talking about our experience, then women won't be so afraid. There's a great fear that I may have breast cancer. And the thing about it is, if you're educated, you'll know that if I do, I intend to survive.
Yes.
There's too much support out there for me not to survive if I do my annual mammogram.
Yes.
I chose that clip with Bacchus Roll for a particular reason as well, not just to help to promote the event and others like it. And it is unfortunate, though, that people are using this to, you know, for commercial reasons. But I chose him because I wanted to use this opportunity to speak to the role of men. As men, we sometimes can feel helpless in this fight because the sister group and the group that you're involved in, there was a women's group where women are involved, and a lot of what we see is being driven by women. What role do men play in this fight with you?
Well, men go through breast cancer
As well.
different cancer as well, and basically, I really don't see any roles being played. Honestly, you know, I thought about it myself and looking at it. You know, men go through this as well. Why is it that there's not at least one male to really pick up that baton and say, "Hey, I'm dealing with this. Let me gather other men and let them know that we too can overcome this." You know, looking at the women and taking that mantle and saying, "I'm gonna do it for men." You know, so it's oblivious to me as to why no one has already risen to, you know, to that stature and say, "Let me just try to do something for men."
Do you feel that we have the adequate medical facilities and professionals to be able to treat it? In your case, your treatment began over in Fort Lauderdale. What is lacking here?
I will not be able to comment too much on what is lacking here.
Sure.
But generally, in my experience 23 years ago, I got a feeling of too much individuality, too many cowboys, too many "I know this is right." What I experience when I travel overseas is teamwork. Every decision that was made regarding my treatment and the way forward was made by a team. And I felt like that is not quite possible here for some reason. I may be wrong, but that is the impression I get from a lot of women that I speak to.
Well, I want to say something on that because I did my entire treatment right here in the Bahamas. And I feel as though it was teamwork as well. My gynecologist, Dr. Sharon Thompson, I would love to call her name, excellent. And she was the one that reached out and recommended me to Dr. Wesley Francis, excellent surgical oncologist, and Dr. John Lunn did the chemotherapy, awesome team. And I had no problems. And I normally, every time I have an opportunity to speak, I speak on those particular doctors. God rest Dr. John. Yeah, he's deceased now, so God rest his soul. But I had a wonderful team of doctors, and I don't feel. To me personally, I feel as though we do not give our doctors that chance to show that they are well experienced in it.
You know, and to be honest,
Yeah.
you were 23 years ago,
Right.
and so hopefully things have changed
Right.
significantly. And I'm happy to hear that you were able to get your full treatment here. And I think sometimes it's just optional. I think some
Yes.
people, it comes down to preference.
That's correct.
What people are more comfortable with. Do you ever feel or hear that other forms of cancer and the people that are battling it are neglected, given that breast cancer gets so much attention?
I feel, personally, I feel as though some persons, whatever they battle, if it's not breast cancer, do feel neglected because more attention and light is shined on just the women with breast cancer. You have colon cancer, you know, you have pancreatic cancer, you have so many different types, but the breast cancer gets more attention. And so I do feel as though some persons, you know, who are battling other types of cancers feel neglected.
Do we ever see that or hear that
Yeah.
from time to time as well, Sheila?
Yes, I do, and I do feel like they are neglected in some
Yes.
way. I think groups like Susan Komen in the U.S. made breast cancer, a blazing story, and that makes the difference. But the
Yes.
other cancers, we in our group at Jenny Dean Caring and Sharing, we support women with all cancers. So we try to do as much as possible to share information and educational material
Right.
on the other cancers. But yes, you're right.
Can you tell from where you sit and the interactions that you have with your organization just how widespread of a problem this is for us? Are you able to gauge that?
Do you mean the problem of education?
Well, no, the problem of breast cancer in women
Breast
in the
cancer.
Bahamas. Are you able to tell really how widespread it is?
Yes, I can, because when you look at it, it's all across the world. And we realize that here in the Bahamas, our women, it's like taking them out by masses. So many diagnoses are being diagnosed every day in all stages and all ages. And so it's extremely large from what we can see. And so that's why even with Jenny Dean Caring and Sharing, like Ms. Sheila said, we try to give the information, have persons come in to really educate us on what is going on. And so that we can go then also, communicate with others, bring awareness to them.
The work that you all do and in reaching out to women and trying to help, are there any roadblocks that you face sometimes?
There are some roadblocks. Mainly, it's a woman's personal decision on how much information they're going to give on themselves. Women seem to be reluctant to say a lot about what's going on with them, so we usually have to pull information out of them. And women must realize that in this battle, you can't have much pride. Okay, you have to speak. You really have to speak, because every stage of breast cancer is different, for example. And we, even at our stage, after 23 years, I'm still learning. It's a learning process. There's constantly new developments, new treatments. There's so much we as women have to share. And if you're not opening up, then it's difficult for us to know where you stand. So we just simply try to share general information, but women need to be more vocal about their condition and not keep it private, because that's where you end up in the grave most of the time if you do that.
As we prepare to wrap up, there are women out there, some who may be watching this particular program, who are battling even now. What do you say to them and to their families? Sheila, I'll start with you.
I say be encouraged, stay positive. It's all about your mindset. You really have to step into this battle prepared to win. If you're not prepared to win, bad things can happen. So step in prepared to win. Like Shakira always say, there's a God there and he's watching you and he's taking care of you. So, but you have to believe. If you believe, you can achieve what you set out in this battle.
Shakira?
Yes, well, I would like to say, first and foremost, have those annual physical checkup. Please, do not feel as though you're exempted. None is exempted. Have those checkups. Early detection save lives. And also for family members who may be going through, support. Your family need to feel that love. They need to feel that care and concern. So give them the support that they need, and have positive people around you for every time. You don't need anyone negative around you looking at what they see and making you feel defeated. The only way you're gonna win is to have that winning mindset. Just like Ms. Sheila just said, you must have that mindset that I am gonna overcome this, and cancer will not take me to my grave.
Ladies, literally words to live by. Literally words to live by. Thank you so much. Thank you for coming and sharing with us today, because it's not always easy to share, your health issues and what you've been through. So thank you, and continued good health, and continue to be a beacon for other ladies who find themselves in similar situations.
Thank you.
Thank you, Jerome.
All right, and continued health, as I said, to our guest tonight. Thank you so much to our earlier guest as well, Dr. Dawn Major, and thank you to our audience for joining us. For the entire team here, I'm Jerome Sawyer. Be sure and stay tuned next week for another exciting topic that directly affects the lives of Bahamians. Until then,